What tissue of the gastrointestinal tract is affected in celiac disease? A. Stomach, causing gastritis. B. Rectum, causing fistulation. C. Large intestine, causing ulceration. D. Small intestine, causing villus atrophy. The answer is D. Small intestine, causing villus atrophy. While individuals with celiac disease can certainly have gastritis, fistulas, and ulceration due to inflammation, the primary effect of celiac disease is villus atrophy in the small intestine. Villi become blunted, leading to loss of ability to absorb nutrients, including minerals and fat-soluble vitamins. Which of the following refers to bleeding from partial thickness tears in the mucosa at the junction of the stomach and esophagus? A. Esophagitis. B. Barrett's esophagus. C. Boerhaave's syndrome. D. Mallory-Weiss syndrome. The answer is D. Mallory-Weiss syndrome. Mallory-Weiss syndrome refers to bleeding from partial thickness tears in the mucosa at the junction of the stomach and esophagus, often from traumas such as violent retching or coughing. This is compared to Boerhaave's syndrome, which is a full thickness tear of the esophageal wall. Esophagitis is most commonly caused by gastroesophageal reflux disease, GERD, and does not present with bleeding. Barrett's esophagus refers to a type of metaplasia in the lower esophagus which is thought to be caused by chronic GERD. Full thickness, transmural, ulceration of the bowel wall occurs in what condition? A. Ulcerative colitis. B. Crohn's disease. C. Celiac disease. D. Irritable bowel syndrome. The answer is B. Crohn's disease. Full thickness, transmural, ulceration of the bowel wall occurs in Crohn's disease. Bowels may also show thickened walls, serosal adhesions, and loss of the regular folds. In ulcerative colitis, ulceration is restricted to the gut mucosa. Celiac disease results in blunting of intestinal villi, but does not cause ulceration in any form. Irritable bowel syndrome, or IBS, is considered a functional disease as it results in no known pathological tissue changes. Janelle is a 56-year-old woman who is 3 days post-total abdominal hysterectomy. She has not passed gas or had a bowel movement since before surgery. The patient starts vomiting dark brown material. The nurse should be sure to do which of the following? A. Administer antiemetics. B. Auscultate for bowel sounds. C. Report the finding to the next shift. D. Have the patient lay on her left side. E. Place a cool washcloth on the patient's forehead. The answer is B. Auscultate for bowel sounds. The patient is displaying symptoms that could indicate a paralytic ILS. A paralytic ILS is a blockage of the intestine that may result after surgery, most commonly abdominal surgery. During an ILS, the intestine cannot move food through the bowel. A patient with this condition will not have bowel sounds. Constipation, nausea, and vomiting are all considered symptoms of an ILS. The nurse is caring for an 89-year-old male who has been admitted for nausea and vomiting. His treatment plan consists of IV fluid replacement of 0.9% normal saline at 150 ml per hour, IV ondansetron PRN, IV prochlorperazine PRN, and an NPO diet. The patient starts to show signs of confusion. The nurse may suspect which of the following? A. new onset of Alzheimer's disease. B. The patient's antiemetics. C. The IV fluid replacement rate. D. The NPO order. E. The IV fluid composition. The answer is B. The patient's antiemetics. Older adults are at high risk for the development of side effects related to medication use. Antiemetics are commonly administered medications and may cause confusion, especially in older adults.